Welcome back to For Mature Audiences Only, presented by Archer Law Office, the podcast where we break down complex aging, caregiving, and elder care topics into clear, practical guidance that you can actually use.
We're your hosts, Mary Shapiro
and Shannon Johnson,
Senior Resource Specialists at Archer Law Office. And each week we sit down with trusted professionals to help older adults and caregivers navigate real-life challenges with less stress and more confidence. If you're caring for an aging parent, supporting a loved one with a serious illness, or planning ahead for yourself, this is an essential conversation. This is For Mature Audiences Only, presented by Archer Law Office. Let's get started. Today we welcome Amy Levine, the Business Development Representative for Visiting Physician Services, a nonprofit primary care clinical organization that is part of the Visiting Nurse Association Group and the Parker Advanced Care Institute. She focuses on developing relationships with healthcare industry partners and providing education to them and the community. Welcome, Amy.
Amy Levine, thank you so much for joining us on our podcast today. We're very excited to have you on to talk about the company that you work for. So if you can, please explain Visiting Physicians, what you guys do and how it works.
Sure. Thank you for having me today. Our practice has been around for over 30 years, providing primary care in the home for older adults and homebound seniors. We are part of the Parker Advanced Care Institute at the Visiting Nurse Association, VNA for short, health group. House calls enable patients to live comfortably at home as they age with an improved quality of life.
Who is an ideal patient for visiting physicians? Like, what kind of patients do you usually have?
Sure. Our ideal typical patient is an elderly person who has chronic medical issues like Alzheimer's, diabetes, Parkinson's, congestive heart failure, kidney disease, et cetera, et cetera. They have frequent hospital ER visits. And there's also challenges and difficulty getting to a doctor's office. Maybe, they don't drive anymore, or they don't have anybody to take them, or it becomes an ordeal, a whole day
Sure,
thing.
it's a whole process to get out of the house.
Exactly.
To go to the doctor.
Exactly.
How does home-based medical care differ from traditional office-based care?
They're pretty much the same. All services provided in an office setting can be provided and managed in the home, which is pretty cool. Everything from physical exams, management of chronic conditions, medication management, as well as diagnostic testing like EKGs, blood work, x-rays, and more. Within home visits, we spend more time with patients, whereas if you go to an office visit, sometimes you're only limited to 15 minutes because that's how the insurance works. The doctors get you in and out really fast.
Right.
And so there's no time limit on a visit, which is really good.
That's huge. And I think that's how it used to be. I know that's one of your taglines. I think the doctor that, just comes to you.
Exactly.
Which I think is a great concept. And most of your patients probably were used to that model to a degree.
Correct.
I never thought about that aspect of, like you just said, the insurances only have you in those.
Yeah.
I never thought about that.
Oh, yeah. I met one physician that had to see 100 patients because they had to just keep going.
So that's an insurance thing, not a practice thing.
I think, I think it's an insurance thing.
Wow, that's cool to know.
Yeah, maybe a combination, but yeah.
So your folks like the fact more that the people that use your services like that, they can have a doctor there for an hour if need be.
If need be, yeah. There's no time limit. We usually give our patients 2-hour windows.
For an appointment.
From 2 p.m. to 4 p.m., they get a 2-hour window.
Okay.
Because it's not an exact science.
No, and especially
different.
if they're coming from another home.
Exactly.
There's some travel and such.
Right. Could be traffic, could be longer time. So that's another key benefit that we have. And we also get to see the patient's living environment, which is important.
Yeah.
Are they hoarders? Is it dirty? Is it not safe?
Do they have enough food?
Exactly. I mean, we've had physicians go in. I've heard stories where they go in and somebody got an IKEA delivery once and they asked the doctor to help put
the furniture together.
That's actually a good one. Yeah.
Because nobody, they didn't have anybody.
Sure.
So they, their prime their prime, obviously, reason for the visit is medical, but if they
They're
can
seeing
help,
the whole
they're seeing the
environment.
whole environment.
Yeah.
And exactly.
So if you guys encounter a situation where someone's a hoarder or the living situation may not be the best, do you
Right.
guys help them find resources to kind of remedy those things?
Oh, definitely. Yeah, the
Great.
doctor or the nurse practitioner, they take notes at every visit. It's all computerized, and then they can see. And we have people that are constantly looking for red flags to see what's going on and how we can help.
That's great.
And who's typically part of a visiting physician team? I know you mentioned the doctor and nurse practitioner. Like,
Yes.
who usually is coming out to the home?
Okay, so we have physicians, nurse practitioners, physician assistants, and we also even have a social worker on call. She doesn't go to the homes to help
nice.
Oh,
to help families
as a
with
resource,
services.
that's great.
Exactly, as a resource. But an MD usually opens a case. So the very first visit, it's an MD that will go in the home and open the case. Nurse practitioners and the PAs will do most of the follow-up. We average about once a month, but if need be, it's more. If need be, the doctor needs to go out. And it's very interesting because visiting physicians has been around for 30 years.
Right.
And now there's a lot. I've been with the company almost 2.5 years, and there's a lot of these companies opening up that'll do in-home medical visits. But the key thing to remember is most of them, I don't know of any of them actually in our area, they don't have doctors making the physical visits. The doctors maybe will do telehealth. The doctors will oversee it from a remote
but they're not going
location.
into the home.
Exactly. So it's a little misleading sometimes for families, and we always assure them, no, you're going to get a doctor. We're very truthful and honest with the services that we provide.
And this physician becomes their primary. Your doctor becomes their primary
Correct.
doctor, correct?
Correct. Yeah, that's something. Sometimes we'll get calls and they'll be like, oh, I have 103 degrees fever and I can't get out of my house. Can you send somebody over? And unless you're a patient of ours, we don't do that. There are other practices that have models like that can do it.
Sure.
And they can send the doctor out and they can still keep their primary. But our model is to keep we're the
Sure.
primary. We're there for the long haul with the families.
Right.
Out of curiosity, I'm sorry, Mayor.
No, go
Is
ahead.
it only seniors that your company works with, or is it kind of anyone that needs a physician at home?
That's a good question. We do work with, I don't know the correct term because my son's on the spectrum, disabled individuals and
Okay.
young adults. We do take some commercial insurance. I know we're going to get into that later. So we do, it depends. It's a case-by-case basis, but we wouldn't take, a pediatric young child or
Gotcha.
something like that. Or,
Sure.
But we do work with the, disabled special needs population.
Case by case basis.
Exactly.
So is somebody able to get like blood work done at home? Can they get X-rays done at home through you guys? How does that work?
We can do X-rays, blood work. Basically, we work with an X-ray company, and they bring the machines in, and we do the actual X-ray and anything you would do in a primary. That's what I tell people when I go out. Think of it, you're going into your primary's office. You get weighed, you get your blood pressure, you get all your vitals, you get an EKG, you get an X-ray, medication management, urine studies, all types of tests can be done right in the home. We work with other, people, partners that will do that, but it can
Sure.
all be done.
I was going to say, I know our cars are usually full of stuff because we're out on the road. What are their cars? Their cars must be full of pits and machines and all kinds of stuff.
Yeah, exactly. I can't even imagine.
Yeah.
It's amazing what can be done in the home nowadays. It
it
really is medically.
It really is. Yeah. So yeah, absolutely.
And what is the biggest benefit other than what we've already talked about for a physician coming into the home? Does it help reduce ER visits for your patients? What are some of the other benefits for quality of life or treatment of a disease process?
That's a really good question. First and foremost, the patient remains comfortable and safe in their home. We talked about the challenges of getting a patient out of the house, a frail elderly patient, and what it takes to get out in the doctor. They can stay at their home, which is great. We can see the big picture, like I mentioned, of being at home, what their home environment is like. You go to a doctor's office, an elderly patient, they're just doing your vitals, quick in and out. Oh, you should see your cardiologist. You should see your specialist.
Right.
They're not getting that full picture of the patient. Also easing stress on the family and the caregiver. You know, we get a lot of calls from family caregivers. Maybe they're in California, but their loved one is in New Jersey. And, you know, we try to, you know, ease their mind. They're being taken care of. We always have somebody on call all the time. We don't have to rely on a family or a friend to take you to the doctor's office. I know that's a big challenge, or even these public transportation companies for the seniors, you know, which is great.
If they can actually get into the bus or get into the transport.
Exactly.
A lot of them are just curb to curb. They don't actually take you into the facility. If it's raining or it's snowing outside and you have a doctor's appointment, that person that's driving the bus isn't getting you off and taking you up into your office on the 10th floor.
Exactly.
They're just dropping you off at the curb.
Good point. Good point. Yes. Mary, you mentioned reducing ER and hospital visits. That's huge. That's really huge, because that's one of our main goals. And there's no long waits in a doctor's office. Yeah, it's one thing you finally get to the doctor's office, but is a doctor running an hour late?
Sure.
Are you sitting there? What other people are walking in?
Right.
What types of, especially this time of year.
Yeah.
You know, flu, RSV, and all that stuff.
We've all experienced that one.
That's a great
We've all experienced waiting at the doctor for,
I know.
You show up a half an hour before or 15 minutes before your appointment starts, and then you're not even seen until an hour after your time.
Exactly.
You know?
And if you do have to wait for the doctor, you're in your own home.
Yeah.
Exactly.
You're in a comfortable, safe space.
Exactly.
And what I'm thinking about, like with not having the long waits, is if your doctor does get backed up,
yes,
sometimes you feel like now they're rushing through your appointment to get to the next
That's
appointment.
a really good point.
So there's none of that with this also.
That's an excellent point. That's so true, because they're on the clock. These doctors are really on the clock.
Right.
Ours aren't. They're really not.
So how can someone get visiting physicians? Who can make the referral to you?
So we have many referral sources, like our subacute facilities in the area. They'll either fax in an order or they'll email to myself or my supervisor, Donna, who's been with the company like 21 years.
I know.
Social workers, we get hospitals. We have great relationship with, we have a partnership with Robert Wood. Well, VNA does. So we'll get direct referrals from all the Robert Woods in the area. Community Health in Toms River is a big one.
Well, they probably see a lot of the populations that when they're discharged home know they're going to need the help. They're not going to be able to come back out to see their primary.
Exactly. Or some of them don't even have a primary. Like we get calls.
That's a great point.
We get calls from people, like from adult children, and they'll be like, "Oh, will you take my mom? She hasn't seen a doctor in 5 years."
Wow.
And we're like, "Sure, of course." And they go out and they evaluate it, and they want to make sure everything's okay. And things change.
Sure, absolutely.
Constantly. But no, that's not an issue for us.
So I know you said you guys become the primary care physician for the client, for the patient. Is there like a coordination with their former primary care of getting them all your information, or are you just starting fresh with that person kind of wherever they are?
That's a really good question too. No, we do have office staff that would get their records when we can. Like for instance, we get from the social worker, we will get the referral, we'll get the face sheet, we'll get any progress notes, any clinical notes. If it's a new patient, and they'll email us. Same with the hospital, what meds they're on, as much information as we can get.
I know probably those patients who have had a hospital stay, go to rehab, probably haven't even seen their own primary for months and months and months because they've been in hospital setting to rehab setting.
Exactly.
And then looking at going back home.
Exactly. Either that, they don't have a primary. And what we're also learning, a lot of primaries are retiring, or they're going, it seems they've had these doctors like 30, 40 years, and a lot of them are retiring and they don't know where to go. They don't want to start, to go with someone new in an office versus us. So we get a lot of referrals in that regard from retiring primary care physicians.
That's a great point.
Yeah.
I know my parents had the same physician for 30 years.
Yeah.
Like they really
so did my grandfather.
stuck
And so
with
did
the
my
same
parents.
parent.
Yeah.
Their same doctor.
Yeah, it's incredible. But we're seeing that less and less is happening. I don't know, maybe but you have a young Pediatricians might be different. I don't know. It's a different category.
Think about that now. I've also had the same primary for the last 8 years. So you don't even really...
Right.
Yeah.
Right.
If something changed, my doctor and I have built a relationship over the last 8 years.
Exactly.
We talk on like a personal level. So I can understand why, that would be a hard transition for someone, especially.
Yes.
So 30 years is a long time.
Especially in the elder population,
Sure.
changes. So
Right.
as we all know, changes, the older you get, the harder it changes.
Right.
Yeah.
And we try to make the transition as seamless as possible.
Do a lot of your clients, like, once they come onto your services, find that this is much better than them going out, and which they would have done it like a long time ago?
We have patients over 100 years old.
Wow.
We've done testimonials. Yeah, it's incredible. It's incredible.
What should families expect on their initial visit, and how long does it take for someone to get established with a visiting physician?
So the initial visit is a physical exam. Again, think about when you go to a primary, what do they do? In a physical exam, they weigh you, they take your urine, your blood pressure, all your vitals and everything. Assessing the home environment, which I previously mentioned. Taking their full medical history. Like sometimes we don't get a lot over the phone. So maybe they'll have an adult child with them or a friend they'll have files and files of notes
Yes.
in a shoebox or something,
Yes.
and they'll go over that nutritional status. What kind of diet do they have? Vitals, reviewing their medications, which is very key. We all know that, managing medication is so important, and any type of diagnostic testing if it's needed. And the process is, so we have an intake. We have a team of medical receptionists that will call the patient or the designated family member or caregiver. And they'll go over all the information, maybe that the social worker sent, their date of birth, their insurance, their address, their medical issues, their pharmacy. Were they in a hospital? Were they in a rehab? It's a very thorough process. It could take maybe 20 to 30 minutes.
Okay.
And it gets all kind of keyed into this computer system we have. And then it goes to our scheduling department who will schedule the visit. And it usually takes about a week for the first visit, give or take. It depends. We cover 8 counties, so it really depends where the doctors are. There could be a doctor in, Marlboro or something one day, and there's a new patient who lives in Marlboro. Maybe she'll get an appointment the next day. But we average about a week for our first appointment.
I think that's a realistic expectation because nowadays when people call to make a physician appointment,
I was going to say,
you're not getting it.
It could be 3 months before you can get a routine physical with your doctor.
Yeah, no, especially for a new doctor.
Yeah.
Right.
If you're not a current patient.
If you're a new patient, you're often having a first appointment time that's pushed out.
Right.
Exactly.
So I think a week is reasonable.
Yeah.
The good old, we're not accepting any new patients for the next 3 months. Yeah, we've all heard that before. Yeah, that's a nightmare. That's an absolute nightmare.
It is a nightmare. Yeah, it's just more and more difficult, for the elderly population with this type of care outside of the house. Yeah.
And I was going to ask, but you already touched on it. Do most of your clients usually have an adult child with them to be there for the intake process? Because as we know, sometimes, the person receiving the care doesn't usually let all the information out that they may need to be letting out. I can do X, Y, and Z when they really, really can't.
Yeah, it really depends on the patient, but it is encouraged to have another set of eyes. I have an elderly mom who's very cognitive and very with it, but I do try to go to her doctor's appointments if I can, if I can, but she's great on her own, and I know she is, but it's always, if you can have even if it's a neighbor or a friend or
other sets of eyes and ears.
Yeah.
Exactly.
So you said that a lot of your referral sources are rehabs, facilities, hospitals. Do you get them from like home care agencies or other,
Yep. Yeah.
healthcare entities, so to speak?
Yes. And I forgot to mention early back, since we started 30 years ago. We weren't like under the VNA umbrella. And I know, Mary, you worked for VNA, so I know you're very familiar with...
I know. I've been saying on every episode I'm seasoned. I've been around.
Exactly.
Yes.
So being part of the, we still operate as our own entity, but VNA is our number one source of referrals.
Sure.
The VNA network, because they'll get the skilled nursing home care orders.
Mhm.
Well, this person doesn't have a doctor. We can't do the orders. The doctor
Right.
needs to do the orders. So that's our number one source.
I know when I worked for a skilled nursing home care, that was one of our biggest challenges is our nurses made referrals to visiting physicians because our people were coming home from their rehab stay, getting skilled home care, but hadn't seen a physician, needed a doctor to follow them, and they weren't able to go out to a physician anymore.
Exactly.
So, I mean, we often in that scenario made referrals to visiting physicians.
Thank you.
Sure. I mean,
and our doctors will also they'll get PT, OT, speech referrals as well.
Oh, great.
sure.
And like you said about the home care, yeah, we do. We mutually refer to each other. Again, our social worker will do that. But we try to give referrals to the home care, like if one of our patients does need it, to somebody that's maybe given us referrals if we can, but it has to be like, the right fit.
Sure. What's best for the patient.
Exactly.
How do you guys communicate with those families that's, let's say, loved one is in New Jersey, but caregiver is out in California or Texas somewhere? How do you guys communicate with them?
We are constantly in touch with phone calls, emails, providing updates, handling care requests. We'll talk to the families, to the caregivers, to the POAs as well. You guys know that sometimes they don't have a family member to be their power of attorney. So we have it constantly in communication. Somebody will always answer an email really quickly or get back to them as quick as they can.
Great.
Do you guys also support those patients that have cognitive impairment or like dementia?
Yes. Our physicians, most of our patients have some kind of memory or cognitive decline.
Okay.
So our clinicians, physicians, nurse practitioners, PAs, all are familiar with how to handle it. And any further red flags or anything, they'll get in touch with the social worker or other resources.
Great. And what should families know about after hours? Like you said, there's always someone that they could call 24/7. Is there, say they're at home with their loved one and they become a client of visiting physicians and an emergency happens and they call.
Oh, most definitely. We always
That's
have
good to
have
know.
a practitioner on call 24/7
Great.
via telephone. And instead of I know elderly people living alone sometimes, they'll, wake up in the middle of the night and they can't stop coughing. And their immediate reflex is to call 911.
Sure.
But we do have a number of somebody that they can call and they can say, look, you should call 911, or they can say, oh, try gargling with some salt water, trying to
Get some triaging first.
Triaging. But if it is a 911 issue, most definitely.
But that's great to know that they can get a live person
Oh, yeah.
24/7.
Do you guys help the families prepare for emergencies at home?
Like I said, we do have the social worker that's helping with the resources and everything like that.
I would think especially to those patients that are living home alone, that if, we're in New Jersey, we can get a hurricane, we could get a earthquake lately, but any kind of a natural disaster.
Yeah, we would encourage the families to, I don't know if there's a registration process with their county Department of Aging. I know Middlesex, Mary and I are familiar with. They have like a card you put all your meds and all your emergency contacts. So if you do call 911, you have it all right there.
Yeah. And I do think other counties have similar.
Yeah, I think a lot of the Department of Aging's or the police, the fire, all the counties do.
And that's something the social worker could help the families coordinate.
Oh, most definitely.
That's great.
Definitely.
Question everybody wants to know: is visiting physicians care covered by Medicare or insurance?
Oh, most definitely. Yeah, so we have, and I'm still confused with, we have your traditional Medicare, which was before all the managed plans came out through all the other insurances. We also take Horizon, Braven, Aetna, WellPoint, and WellCare.
Okay. Wow.
There are many that we get requests for that we don't take We are working on it. It's over my head with that stuff.
Sure, but I'm sure that's what intake does.
Yeah.
Exactly.
Like
Intake will screen it. And what's a good thing, like a lot of people, they have, say they worked for the government or as a teacher or a veteran, and they have these other like special insurances, we could take them as a secondary. A lot of them have it. As well as like insurances we don't take as a primary, we take just about everything as a secondary, which the $20 to $40 copay would help the family.
Sure.
We also don't take Medicaid. However, if they do have the traditional Medicare or the Medicare Advantage as their primary, and they have Medicaid as a secondary, we would absorb the copay for that and help the family out.
Nice. That's probably one of the benefits of being a nonprofit.
That's a good point, Mary. Mary, I know you know a lot about nonprofits. Yes. And also being a nonprofit, we do try to help. We do get calls. Upper management decides if we take certain situational patients, maybe who don't have insurance.
Sure.
There's some of that we do as well. Again,
that's great.
Being a nonprofit, everything goes back in for training for the patient, for care.
Well,
I think that's a great thing.
We don't have shareholders, we report to.
It gets back to the common goal of why we're all in this, and it's just to help people need the resources.
Exactly. And if we can't help, just like when I was in private home care, if we can't help, we'll refer to somebody else.
Sure.
And I don't like to call them competitors. They're they do similar things to us, but maybe they take the insurance we don't take.
Sure.
They maybe can do the one-time visit.
It's a collaborative effort.
Exactly.
Yeah.
It really is.
We could have a whole episode about that.
That's our mantra.
What do you think is one of the biggest misconceptions people may have about visiting physicians?
I think people don't believe that doctors do make house calls. I mean,
I was going to say that.
They're not nurse. And again, nurse practitioners are great. I'll see nurse practitioners in my doctors if I can. My 85-year-old mother will see her nurse practitioner if she can't see her doctor. But the key differential for us versus many, at least I know in New Jersey, is that we have actual physicians that will go in the house, and they do make house calls. And the other one is all the care and services could be brought to the home. We were talking about the x-rays and everything.
I don't think people realize that you can replicate, like you said, everything in a doctor's office can be done at home. All those testings and the same physical you get in an office can be done in the home.
Exactly. Like your home becomes the office.
Right.
Right. And you're a little more comfortable. You're not on those final chairs.
Right.
You know what I mean? Yeah, absolutely. And then, and then the other misconception is, like, I'll go to presentations and stuff. Oh, do we have to pay for the doctor's gas to get here? No.
Oh, wow.
Oh, that's actually a good question.
Yeah,
it
is a good question. It's all lumped in, mileage, tolls, everything. There's no extra charge for that.
Sure. Well, that's good to know, actually.
What signs may indicate for a family that it might be time to consider a visiting physician?
Maybe they have, like we had mentioned, they may have difficulty leaving the house. As we talked about, it's becoming so cumbersome for them to leave the house and challenging. They have cognitive, physical, behavioral and or mobility issues. We get calls, my mom won't get out of her chair and her bed, and I've been trying to get her into the car to go to the doctor. Can you please help me? We get like SOS calls and emails about this as well. And let's see, where was I? Oh, multiple chronic health issues, which we talked about. Maybe they have mobility and diabetes and Alzheimer's.
Sure.
It's a lot. And frequent ER visits is a big one. One of our big goals is to minimize the amount of ER visits and giving them the care at home in a responsive, timely manner.
And if they're already challenged to get out of the home, to go to a doctor, I can imagine ambulance to the ER sit on a constant basis has to be so traumatizing.
Exactly.
For the patient and family.
Exactly. Definitely.
I'm also thinking about it being a great resource for the families that have the loved one that just had to take the keys away and they can no longer drive. Now, they can still are able to get that same care.
Sure.
Maybe
They
take
can
some stress over the family, but now, you just change the situation now.
Yeah.
Instead of you having to drive, now the doctor's going to come to you. You know?
Right.
So
Exactly.
Right.
it's really, really a great benefit that I think a lot more people probably should be taking advantage of these days.
And I don't think they realize.
Right. Just out of simple convenience for not only the person receiving the care, but for the adult children that may be
Sure.
the caregiver themselves.
Exactly.
Because Mary and I both have clients that are always, I got to leave work early to go take mom
Yes.
to the doctor.
Right.
And then, got to make sure it's okay with work. And, you might have kids who have a schedule.
Mhm.
And
That's,
this would alleviate a lot of those stressors by
oh
just
my
having it
God.
come home, get the report from the doctor, and then go on about your business.
Exactly.
Yeah.
And they really become like part of the family. We
Sure.
we get cards from people. Their loved one dies. That's a patient. Oh, we love, the care,
Mhm.
Dr. So-and-so or NB so-and-so gave us. We've had videos done at homes. We really become part of the family. Our clinicians do.
And you said, do they come once a month then to check
The average
after
is
the initial visit?
Yeah, the average is about once a month. If they need it sooner, yeah, of course we'll go. But that's like the average.
That's great because even I think office visits, you're coming back once every 3 months.
Yeah.
Yeah.
So the fact that you're getting someone coming into the home, laying eyes on your loved one, seeing the environment, that's huge.
Yes.
Amy, thank you so much for coming today. Great information about something that we think more people need to be taking advantage of just to ease the stress on themselves,
And that it's an option.
that
That people might not have realized
they don't
it's an
realize it's
option.
out there.
Absolutely.
We see a lot of people struggle to drive. Your eyes start changing. Life happens for all of us.
Exactly.
People have work and children and all those things. This is a great resource to alleviate some of those stresses off your family. And like we like to say, just get back to being a family.
Right.
If you can eliminate
Exactly.
that one stress, you can get back to just going to mom's house to spend time
Yeah.
with her and not going to have to take her out to her primary, then her cardiologist, and then her eye doctor and all those things.
But
So
we
it's-
do just to clarify, they would still keep their specialists, the cardiologists, the endos, and all those. We're just the primary. But Mary, like you guys know, there's in-home dentists.
Right,
Yeah.
absolutely.
It's
There's a
amazing what
lot.
can be brought in.
There's
Exactly.
a lot, yeah. But the
Exactly.
specialists, they would still have to go out to see.
Sure. Something that we ask all of our guests on, we're all in this crazy field. But you got to have a special heart to work in it. So,
Yeah.
what's your why for working in this industry?
Oh my God.
Everybody gets asked the why
Oh
question.
God. I mean, I take the why. This is like a second career for me. I used to be in like highly stressful marketing, project management. Then I had my kids and I went back to work and I was doing a lot of volunteer work and things. And I happened to fall in a job with Jewish Family Services. I said, oh, this is really cool. I can manage volunteers. I was doing that before. I liked the give back. I liked the volunteer. Well, it turned out it was a volunteer program for it was seniors involved through AmeriCorps, stuff like that. And then we would do programs like with Holocaust survivors, they'd come and eat and other types of, volunteerism program. And I felt, working with seniors just gave me a new sense of purpose and give back. So that kind of fell into the working with the senior
I love
healthcare.
that.
Yeah.
That's a great why.
Yeah, it is. And thank you
Yeah.
for all the work that you do and
Yes.
keep up the great work.
Thank
And
you,
thank you for
guys.
sharing all this great information.
And thank you guys for inviting me. I feel very honored and privileged to share.
And people can find visiting physicians online.
Yes, it's under it's vnahd.org/VPS. We do have a Facebook page, a LinkedIn page. You can follow us on Instagram. If you it's interesting because it's like visiting physicians is a generic term.
Sure.
Visiting physician services, but we always come up most of the time.
Great.
Awesome. Thank you so much,
Thank
Amy.
you. Thank you.
If you found this episode helpful, please be sure to subscribe, leave a review, and share it with someone that it could benefit.
Just remember, you don't have to navigate aging or caregiving alone.
If today's conversation raised questions about elder law, long-term care, or planning ahead, please visit jerseyelderlaw.com or call 609-842-9200 to find resources and support.
This is for mature audiences only, presented by Archer Law Office. Until next time, keep pushing forward and keep the conversation going.